So I request Akshita to introduce Dr. Puneet Dhar. Akshita is a third-year MBBS student from Mahatma Gandhi Medical College, and she's been the force behind this entire volunteers who are all helping us over the past 3 days. So her hobbies include narration, writing, reading, dancing, singing, photography, and last but not the least, slam poetry. I had to actually Google to find out what is slam poetry. That's how backward I am. She's authored several anthologies and has published her standalone poetry book called Sonder. You're Not Alone in the Cosmos of Life. So Akshita is an example that we need not wait till we become 50 to continue with our passions. She's a future psychiatrist in the making, and she loves spending her time understanding depths of human nature and its neurochemistry, which I thought will bond her with Dr. Abhijit Dham. So over to you, Akshita.
Thank you, ma'am. Good afternoon, everyone. I am honored to introduce our next speaker, Dr. Puneet Dhar, who is a surgical gastroenterologist by profession and has more than 30 years of experience in his field. He has published extensively in a wide array of journals and book chapters, a multifaceted personality with keen interest in geography. His interests range from quality cinema, photography, to bird watching, music, theatricals, and performing arts. After his medical training in Delhi, he went for a fellowship in transplant surgery at Cambridge University Hospital Trust, UK, and also worked there as a locum consult. He did his MCH from the GB Pant Hospital as the first MCI recognized center in the country, and subsequently worked there as a specialist before moving to the prestigious Amrita Institute of Medical Sciences to set up what became one of the largest and best GI surgery centers in country. Before joining there, he also set up the department at AIMS Rishikesh as professor and head, where he was the dean of student welfare. He has been an active member of several professional societies and served on executive committees. He is the president of Indian chapter of International Hepato-Pancreato-Biliary Association and Haryana chapter of Telemedicine Society in India. He is the governing body of Sher-e-Kashmir Institute of Medical Sciences and has been involved in charitable events as well as Rotary in various medical and non-medical admin capacities. He's a regular organizer of CMEs and medical conferences. Please join me in welcoming Dr. Puneet Dhar on stage.
I think it's a privilege to be introduced by Akshita, and I think it's no serendipity, even though it's an accidental thing that it follows Abhijit's and Sri Vidya's, because there's a sort of a continuum, as you'll probably realize in the entire thing. So humanities for humanized medicine. So I'm sure many of you are looking like this, as puzzled as this squirrel wondering what is this bird watcher looking at a mammal for. So it's basically just wanted to introduce the concept of medical humanities, because although it's a part and parcel of what we do, it's the codification of it. And there's sort of two parts to it. One is how it's going to help the patient, and the second is what the preamble bit showed you is how it helps us actually. So basically, while we are doing our core training of science and the science and technology of medicine, it's important to highlight the impact medical humanities and social sciences can do to our medical education. So I think about a century ago, this shift came when research was sort of pushed into the forefront, was mandatory. And that's where I think that whole art of medicine science started becoming a science, which was good for the progress. But I think expecting each and every person to be a researcher or a clinician, I think we need to realize that we're all different people and different skill sets. So it also helps us to understand human behavior, societal factors, the cultural context. Go from even from north to south, you'll find a lot of differences. And that will help us to, give compassionate and effective care and take good care of ourselves. So why do we need it? So enhancing patient-centered care. So all these, social sciences, they offer, deep insight into the human experience of illness itself. What Abhijit was telling you, I saw fantastic, one of the army gastroenterologists gave a lovely presentation of what the patient's artwork, so the combination of the two of you, how they went through those various grief cycles, the shock, the acceptance, the depression, all those with art. and with fantastic piece. I think I borrowed that thing. I think we should ask that person to share it on Marvelous Medicine as well. So it gives you that insight which, we become so detached. I've got 60 patients today, I have to finish them, and that's crucial. So we all actually have the time, the time you spend in having that coffee or smoke or booze or whatever outside. So Sri Vidya talked to you about that 1 hour. Just make sure you spend that 1 hour well. Don't do it on PUBG and all the other crap which is available and possible. That's a waste of time. So you can actually use it to your advantage. They teach us to see beyond the symptoms and diagnose. You look at the social history. Will the next monoclonal antibody kill the whole family apart from just that patient? So you need to look at the social background behind that. So this actually fosters trust. And you see the increase in, the distrust between doctors and patients because of that. So this actually fosters trust. You see the patient, in Cambridge, I saw this lady reading a book on blue pottery, and she told me so much about it that I opened my eyes. I went to Jaipur and saw the blue pottery there. And, I still have kept the card which he gave me that, to the doctor who actually had time beyond his thing and all that. So, which was bizarre that I, as an Indian, who we are used to not seeing patients so personally. So ethical reasoning. A lot of times, you have this thought process that this is the answer to this. You have a pseudocyst, you have to do a cystogastrostomy. You have this, you have to do that. The patient has to enter an emergency room and he has to go with an antibiotic. There's nowhere is that mentioned. But if you look a survey of 100 casualty admissions, 80 of them will have an antibiotic. I have no clue why. I'm part of this effort where we combine social sciences. So it's an Aspire's study along with South Africa, Imperial London. We have this, how we can use social sciences to impact this change. The philosophy, who's the person, the anthropology, who's the person deciding those changes? Is it the senior resident who's most scared that he'll get a scolding because of the kind of hierarchical setup we have? So understanding all those within our cultural milieu is very, very important to look at the ethical reasoning behind it. How do we allocate resources in our resource constrained settings? It allows for critical thinking and reflection. So, question assumptions, evaluate the evidence. So, we are so evidence driven that we don't realize what we don't see. So I challenge each of you, when you're looking at evidence for anything, look at clinicaltrials.gov. That has mandatory registration of trials. You'll be shocked to see the number of studies which are completed but not published because it didn't favor the people doing it. So to put it in simple words, you have 100 trials of an antibiotic. 90 of them showed no result. 8 didn't finish. 1 showed a good outcome. That's the only one gets published. So that's the evidence that that's an effective drug. So please weigh that evidence with common sense as well. So you need to understand all that, and only when you read and look at all these things are you going to be able to do it. The advocacy for the patient and social responsibility, when the research went to one extent that in the middle of, halfway through the time we shifted those in 1910 to now, is the Hitler, the Nazi experiments, where all those doctors thought they were actually advancing science. They did, by the way, but at what cost? And at the same time, even in the US, it's not just, blaming the Germans. The famous, I don't know if you've heard of Tuskegee experiment, where they denied the syphilis treatment after penicillin was available to see what the results are going to be. It's a control group. And that's what led, there's a fantastic movie called, HBO movie called Miss Evers' Boys. If you ever get a chance, please see that. So, so advocate for social responsibility, healthcare equity, which in our country we need much more than the countries they're talking about it. Those guys can still have deeper pockets than we actually do, and utilize it well. For you personally, effective communication skills. All the committees I sat on where the doctors had got bashed up, the one leitmotif in all those was poor communication. The patient's relative comes, knocks on the doctor's door. He says, I will see. So, you can, so the lesson to learn from that, go and see beforehand, communicate with the patient. He's a cirrhotic, he's an alcoholic, he can have anything. And then, tell him all the possibilities. When he sees that, he doesn't get a shock and, he doesn't come running. He's already accepted that. So a bit of what Abhijit said, preparing upfront, and that medical oncologist also, all those things are very, very important in effective communication skills. It also teaches us to listen, because we miss a lot of symptoms and a lot of, disease patterns and tracks. And the bird watching taught me that when you look at a simple bird and then you see a similar bird and you realize what are the differences, and differential diagnosis is exactly that. You see what is difference in that, and you're able to spot out what's what variant of the disease or a different disease it is. So how do we do it? Very, very simple tools. Read books. Yesterday, we unofficially had a chat with some of you, and I think only one person, and that too after I prompted, said that book reading. So I was very, very, surprised to see the change in 20 years, the last 20 to 30 years. So my suggestion, I guess, we cannot turn that clock and tell anybody. I've tried in schools in Cochin. We used to go and have book reading days and all that. In some places, it's a success. In AIMS Rishikesh, we started a book reading club, which is a huge success. They still send me all those photographs. But that's a very simple way. But for those of you who can't, at least audiobooks are a fantastic newer addition to that. They don't substitute, because they are building up that picture which you can't pause it. So you're not in tune with the way the author wants you to be. Movies, very easy, and as a group, I think that's what your name itself has MGM, Metro Goldwyn Mayer. If you chimerize Mahatma Gandhi Medical, so you can have a film club here, and so Rishikesh, Cochin, Amrita, Faridabad, and the Kerala Museum. I've started 4 film clubs, and a fantastic way to channelize your thought processes. So the movies I showed in these places were Patch Adams, which shows you about, basically looking at a person with empathy. Miss Evers Boys, I just told you. My Sister's Keeper about ethics. Tuesdays with Maury. All these fantastic movies about diseases. My Brother Nikhil about AIDS. Air Zindagi about organ donation. The fantastic Japanese movie called Departures, Okurubito, which is about how the dignity of dying and all that. So theatre of, UCMS and the army colleges, they've used this theatre of the oppressed, where the spectators, or rather spectators, actually try to tell you what they start the thing, and then they, shift the thing like an improv theatre to the role-playing case studies. We just talked about creative writing, reflections, artwork, comic, all those can help. Of course, Marvelous Medicine is also fantastic. Every 1/4 of the sessions are, dealt with that. Philosophy, I think, is very important, because that's where we, and like the medical oncologist said, cancer as a paradigm, if you see, it's so polarized, curative, palliative. We are not looking at the shades of gray in between. And that's where this polishes off you need to ask yourself, what will happen if I do nothing? You'll be shocked to hear the answers. Hernia, every medical student every MS surgery student, the expert is taught needs surgery. 90% of hernias which are asymptomatic never need surgery in their lifetime. Huge randomized trials showing that. Yet we scare the patient into getting, so you need to know what will happen. What is the natural history of this cancer? Prostate cancer, he might die of your intervention. He might not die of the disease. What and how effective are the alternatives? Would chemoradiotherapy be actually better? How much can the patient tolerate the disease? Let not the cure harm him more than the disease. The whole family, like Abhijit was talking about. So, just to end up with Osler, who was the guy who actually challenged that a century back, the same when all this research stressing thing was coming in, he said humanism is going to go away. And I think that was prophetic. Now, when I was just looking at his sayings, he says it's not a trade, it's a calling, not a business. Calling in which your heart will be exercised equally along with your head. So he says, science and art are 2 berries on 1 stem. Grievous damage has been done to both in regard to humanities and science in any other light than complement. So in the arts, you need a lot of science, to match those colors. You need to know what is the physics of the colors. In every art, it is like that. In a poetry, it is a lot of the, yesterday you said poetry. You need to know all those iambic pentameters, all the, the meters and all that to actually write good poetry. So each one actually, complements. So it's very important to integrate medical humanities into your medical education, enrich your clinical practice, transforms you not only into a skilled clinician, but also compassionate healers who understands and responds to complex social and human dimensions. And last but not the least, what the entire movie showed you, equip you not only with technical skills, but also with the emotional intelligence and ethical framework to provide holistic care and, prevent burnout, help yourself. Life is an echo. You're going to get back exactly what so you're going to reap like that. I thank you for a patient listening.
Quite often, see, it's easy to sort of say we have to teach humanities and practice ethical values. But in the current setting of business kind of system, even the medical education has become like that. Do you think it will be practically possible to implement these things? Because in the practice, you see, quite often, even in US, they had done a lot of these radical prostatectomies where it was not indicated. So do you think this business and the environment will not allow this humanity?
Absolutely, sir, because we've got a huge philosophy behind our own ethos here. So I think if nowhere else in India it is possible, and I think we need to start that, like Patta was saying, to at this age, because you can't change old tiger spots. So it has to start, like Kalam used to say, start with. So that's what I'm most impressed with this kind of models, because we need to do that. It is possible, and I think probably very easy to do as well. So, I mean, especially the worry I know most of the students have is that there's so much of coursework already. All that crap is now so easy to, you can do chat GPTs, and that's where you save that time, when the question was asked of Dr. Sharif in the morning. So that's going to cut through all that. All those branches of the middle meningeal artery are available at a foot. We don't need to push them into mugging all those things. Dates. I hated history because I was asked to do all those things. But the philosophy. Sorry, Patta, you want to ask?
A very simple question at that. See, you're talking about movie clubs you started in different places. See, these days everybody has got a movie theater on mobile. They watch. If we remember younger days, people go for movies to have popcorn together. So, what is your movie club that watching together? How is it different?
Very interesting that you say that, because they did get the popcorn and they said that nobody's going to come. Everybody has these torrents and they can watch those same movies at home. But the moment it became popular, it was very surprising how it built up. So it's not for there was an attempt to get it hijacked with the cricket team and the Marvel movies. But see, those you can watch anytime. The ones where you need to discuss, like in Kerala Museum, the thing became such a fantastic tool to it's a literate state. But we had movies on transgenders, gay issues. After one of the movies, actually, one of the kids in Rishikesh came up to me and said, I need counseling for that. I said, I'm not the right person, but, I'm so happy that this has helped you to come to terms with these kind of things. So, we see a lot of things as kids. We were not taught, we were told transsexuals being, chakkas, and we laughed at that. I feel so ashamed of myself for doing all that. So I think this normalizes a lot of that in a way that is not possible otherwise.
So who curates what movie gets watched? So
we do have a sort of a faculty overview, but they take in Rishikesh they take a online poll. They suggest some movies and they choose between that. Now they've started sort of rotating between empathy, pure entertainment. So 1 in 6 is a pure entertainment as well.
So your book clubs also like this. This is a
book clubs. Actually, the kids took off much more than it doesn't need our curating. It's fantastic. It's they get together. They do sort of like a theater reading, and about a month in advance they tell them what all books, and the people can choose whatever they want, and then they discuss them and what is good about them.
That actually brings the beauty of medicine. The human nature. If you nurture it in a student level, it will be really good.
Absolutely. I mean, I was just telling somebody, like, they said, when were you in JIPMA? I said, I wish I was there sometime. I was never there, because, there are only 2 or 3 campuses in the country I've seen which are so complete for holistic development of the brain. JIPMA, AIMS, Delhi, and, AFMC. I haven't seen that level of thing anywhere else.
We did have a movie club. If you remember, we used to go in the night and watch black and white.
So I'm sorry, I think one slide got missed out on the community activities which she mentioned. I think it's there. I just rushed through it because the bell rang by then. The community activities do help you to get that empathy automatically. when at the undergrad level, you get that excitement of seeing that person, little bit of help, gets that smile on their face, it is going to turn you into an empathetic physician for life. You're not going to say, I'm going to tear your paper because you showed it to somebody else. I've seen such nonsense happening, hierarchical systems and all those kind of things.
So may I invite Akshita to do the honors?